Hi, thank you for watching Digging to China. I'm Dongsheng. If you have not done so already, please subscribe to my channel. Thank you very much. In early December, Beijing abruptly made a U-turn on the zero-COVID policy. It not only surprised the Chinese citizens but also health experts, because government officials appeared to have done little planning for the upcoming COVID tsunami, which was easily predictable. With the increased spread of COVID in China, there is a shortage of antiviral medicines such as Pfizer's Paxlovid. As a result, citizens are turning to the black market to buy these medicines. Pfizer's Paxlovid is the only foreign medicine to treat COVID that has been approved by the Chinese government for nationwide use. In mid-December, China-Mexico Corporation reached a deal with Pfizer to import and distribute the Paxlovid. And in August, Pfizer announced a deal with the Zhejiang Huahai Pharmaceutical Company to make Paxlovid ingredients in China. In a statement, Pfizer said that it was collaborating with all stakeholders to secure an adequate supply of the drug in China and remained committed to fulfilling the needs of patients in the country and across the globe. It added it was also committed to bringing medicines and therapies, including Paxlovid, that would benefit the country's patients as soon as possible. However, ordinary residents in China have pointed out that they were not able to buy Paxlovid despite the government importing thousands of boxes of this life-saving medicine. A user on a Weibo platform said in mid-December that she was buying the generic Paxlovid made in Bangladesh because she had an elderly relative and couldn't get a hold of the medicine in China. Another Weibo user called for easier and quicker access to the pills. People who are able to buy Pfizer's medicine are paying astronomical prices. According to a report by the 21st Century Business Herald, a white-collar worker in Guangdong who did not wish to be identified paid 5,800 yuan, about $830, to a Hong Kong agent for a box of Paxlovid, which is more than double the official price in mainland China. The report added that purchasing agents sold over 50,000 boxes of foreign antivirals since the Chinese government's first steps towards easing the zero-COVID policy. Now, with COVID cases increasing exponentially and a severe shortage of approved antivirals, Chinese residents have resorted to underground channels to source the drug and various generic medicines. According to domestic news report, Scalpers have reportedly been charging as much as 50,000 yuan, more than $7,100 for a box of Paxlovid, over 20 times its original price. The original price of Paxlovid is 2,300 yuan. Generic version of the medicine sell for around 1,800 yuan. China approved the use of Paxlovid in February for treating adults who have mild to moderate COVID-19 symptoms and a high risk of progressing to a severe condition. It remains the only legally imported medicine for treating the disease. Given Paxlovid's limited supply and expensive price, other generic ones are in hot demand in black market. For example, Primavir, Paxista, Mononet, and Monotrees. Shanghai resident Sun Jianwei told online media outlet Sixth Tone that he was considering asking his Hong Kong-based friend to buy a generic version of the drug, which is made in India. He said he had failed to purchase Paxlovid through legal channels. Not only Paxlovid is lacking, China is struggling to ensure an ample supply of common medicines used to treat colds and fevers. Authorities have urged the pharmacies to sell medicines in smaller packages so more patients can get them. Amid the grim situation, some people are crowdsourcing medicines for vulnerable rural residents, while tech giant Tencent has developed a mini app where people can offer and receive extra drugs or other health equipment. Online, many social media users have criticized the Scalpers for pushing up drug prices at such a critical time. A related hashtag translating to "Scalpers selling Pfizer COVID medicines for 50,000 yuan" had been viewed 6 million times as of last Wednesday afternoon. Meanwhile, doctors have warned against rushing out to buy antivirals, which they say should only be taken under medical supervision to prevent potential side effects. Sha Kefu, a Beijing-based doctor, told media, "Healthy young people with a good immune system can recover from current Omicron infections on their own. It's not necessary for everyone to use Paxlovid. We only prescribe it to those who are seriously ill with obvious lung infections." Apart from the drug shortage, China's healthcare system has been overstretched across the country. Data from the National Health Commission showed that the country had 181,000 ICU beds as of December 25th, or 12.8 beds for every 100,000 people. In the US, there are 34.7 ICU beds per 100,000 people, and in Germany, the number is 29.2. What shocked people the most isn't that Beijing scrapped its zero-COVID policy, but how suddenly it did so. Observers expected to eventually ease restrictions, but most thought this would be done gradually over a period of months, allowing the government time to build up ICU capacity and vaccinate its vulnerable elderly population. That would have been in line with Beijing's carefully crafted image of a responsible government that puts its people's lives ahead of all other considerations. At the very least, observers expected to see adjustments in the propaganda narrative to lay the groundwork for the policy to be rolled back. Instead, they saw the opposite. Days before the policy shift, officials continued to insist that zero COVID was the only way forward, and the state-run media even censored World Cup soccer matches so images of unmasked spectators wouldn't cast doubt on the official narrative. Only after the policy was scrapped did the narrative change. It's too early to tell how the unfolding COVID-19 crisis will affect the CCP and Xi Jinping, given how vigorously the party had tied its legitimacy to its ability to keep COVID-19 infections low. Significant challenges are likely in the horizon, but these challenges are unlikely to threaten the CCP's grip on power or Xi's authority within the party. The CCP has faced massive policy failures before, and none of these failures seriously affected the standing of the party or its leader. The breakdown of zero COVID may cause Xi to temporarily retreat from the public eye, as he did following the initial cover-up in 2020. But Xi emerged from that crisis more powerful than before, and there is no indication that this time will be any different. After all, he still controls the propaganda and the security services, and he has plenty of time to rebound before the next leadership reshuffle in 2027. Beijing's response to the pandemic is quite telling. From its initial cover-up, which directly contributed to a localized infection turning into a global pandemic, to its dehumanizing zero-COVID policy, which brought so much disruption to China's economy and its people's well-being, and now its abrupt decision to abandon pandemic controls and leave those same people to fend for themselves against a virus it had conditioned them to fear. Everything is showing what an ineffective and irresponsible Chinese communist regime it is. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.